We are going to talk about an important chapter, measles. This is a very important chapter in pediatric section. Measles. Okay. Measles is a very important disease in pediatric population. So let's first go into etiopathogenesis. So describing about the etiopathogenesis, uh, it is common and serious childhood exanthematous illness caused by this RNA virus, which belongs to the group paramyxovirus family. It is transmitted through droplet spread from nasal and throat secretions. Okay, nasal and throat. So the transmission occurs. So if this is the rash, it occurs 4 days before the transmission occurs 4 days before the onset of rash and 5 days after the onset of rash. So this is the transmission phase. So 4 days before the rash to 5 days after the rash, it's highly contagious. So it is highly contagious, and secondary attack rates is more than 90%. So what is the portal of entry? Portal of entry is respiratory epithelium. Okay, respiratory epithelium बाट सर्ने हो. So the primary viremia occurs resulting in infection of the resulting in infection of the reticuloendothelial system, and it is followed by secondary viremia. Okay, so the incubation period of measles is 10 days. Clinical features of measles. Okay, so what are the clinical features? Now you can see from this, it commonly affects the preschool children. Okay, preschool children ma huncha, and the infants are protected by the transplacental antibodies, which decline by 9 months. Hence the rationalization for vaccine after 9 months. Okay, vaccine. So there are prodromal features. So the prodromal features include fever. There is rhinorrhea, means running nose. There will be conjunctival congestion, and there is a dry hacking cough. Now the most important finding you have to understand is Koplik spots. What are Koplik spots? The Koplik spots, they are the pathognomonic of measles, and they appear on 2nd or 3rd day of illness. It appears gray or white grains of sand-like lesions with surrounding erythema opposite the lower second molar on buccal mucosa. So this is very important, Koplik spots. The rash appears on fourth day with rise of fever. The rise of fever, and what do we see? You can see there it appears as faint reddish macules, firstly behind the ears. Okay, firstly behind the ears along the hairline. Okay, from there to other hairline on the posterior and on the posterior aspect of the cheek, as well as in the cheek. So the rash becomes maculopapilla. So rash goes on to become maculopapilla and spreads to face, neck, chest, arms, trunks, thighs, then finally into the legs, in that order, in 2 to 3 days, and starts fading in the same order. So it fades in the same manner. Okay, it fades in the same manner from face, neck, chest, arms, trunks, thighs, and legs, and it leaves granny desquamation and brownish discoloration that fades over 10 days. So modified measles, these are also called modified measles. So modified measles मा चाहिँ के हुन्छ भन्दाखेरि it occurs in partially immune individuals. Okay, partially immune individuals, and it is milder and has got shorter illness. So there is other form of measles which is known as hemorrhagic measles. Hemorrhagic measles is purpuric rash, and there's a bleeding from nose, mouth, or bowel. Now we go on to talk about the complications. So what are the complications of measles? There's a widespread mucosal damage and significant immunosuppression causes complications, which is seen with this viral infection. It is very common in very young. It appears very common in very young, malnourished, and immunocompromised मा चाहिँ बढी हुन्छ. So what are the chief complaints? Chief complications are otitis media and bacterial bronchopneumonia. So what are the common organisms affecting it? Some of them are pneumococcus, staph aureus, and some gram-negative bacteria. So now we'll go on to describe some of the respiratory complications. So respiratory complications include laryngitis from up to down. Just go on telling this. From laryngitis, tracheitis, there's bronchitis, there's a giant cell pneumonia. Also, it also leads to bronchiectasis, and there's a flaring of latent tuberculosis, and there will be the transient loss of tuberculin hypersensitivity. Transient loss of tuberculin hypersensitivity. Now we go on to talk about GI complications. So what are the GI complications? The GI complications include persistent diarrhea. Okay, some children can present with appendicitis, while others may have hepatitis, ileocolitis, and can precipitate malnutrition and can lead to gangrene of chicks as well. Now we go on to talk about the neurological complications. So neurological complications include acute encephalitis. There's very high chance acute encephalitis, there's 1 to 2 per 1,000 cases. And there will be post measles encephalitis. So post measles encephalitis occurs after recovery. It occurs after recovery and is due to suggestive of immune mechanism. There's a very dreaded complication which is also known as subacute sclerosing panencephalitis, which is also known as SSPE. It occurs several years after infection. So what is the frequency? It's just 1 out of 100,000 cases. So now, how do you diagnose a case of how do you make a diagnosis of measles? So clinical, it is mostly clinical. So you can see IgM anti-measles antibody, which is present 3 days after the rash and persist for up to 1 month. Okay, the rash is milder and fever is less prominent in rubella, enteroviral and adenoviral infections. In roseola infantum, rash appears once fever disappears, while in measles the fever increases with rash. The fever increases with rash. So in rickettsial infection, face is bared, which is always present in measles. Face is always involved in measles. In meningococcemia, the upper respiratory symptoms are absent and rash rapidly becomes petechial. Drug rashes have history of antecedent drug intake. The Kawasaki disease mimics measles, however, the glossitis, cervical adenopathy, fissuring of lips, extreme irritability, edema of hands, and discoordination are distinguishing features in Kawasaki. So now we'll talk about the treatment. Since it's a viral infection, the treatment is usually supportive. It is just supportive, and it consists of using antipyretics and maintenance of hygiene. We have to make sure that there is adequate fluid and calorie intake, and there is obviously humidification. Okay, so vitamin A reduces morbidity and mortality of measles, and a single dose of 1 lakh units below 1 year and 2 lakh units over the age of 1 year is recommended. So 1 lakh and 2 lakhs. For 2 lakh international unit is recommended over the age of 1 year. 1 lakh is recommended below the age of 1 year. So complications should be managed accordingly. It is preventable and potentially eradicable. It's an eradicable disease through immunization. Thank you. Thank you.